Alrighty, good afternoon, everyone. My name is Megan King, and I am one of the public health educators at the Washington Poison Center. We are so happy to have you all here today to join us as we discuss medications and falls. I have two excellent speakers for you today who I'm so excited are with us to lend some of their knowledge and expertise. We have Marlo Murray, who is one of our pharmacists in our call center, and we have Katie Bondero, who is our managing director at the Washington Poison Center. How about I give you two a couple seconds to introduce yourself?
Thanks, Megan. So my name is Marlo, and like Megan said, I'm one of the pharmacists at the Poison Center. I'm also a C-SPI, and that means I'm certified in providing poison information, certified specialist in poison information. I've been with the Washington Poison Center for about 11 years now. And I also trained as an intern as a student when I was in pharmacy school. So been with the Poison Center for quite some time, and I'm also one of the Poison Center call room supervisors. So that's a little background about me. Katie, do you want to introduce yourself as well?
I'm Katie Bondero, and I'm a registered nurse, and I've been with the Poison Center for about 27 years. I started out on the phones just as Marlo did, and as she's worked her way up through the organization, I've done the same thing. I'm now the managing director of the Poison Center. Although I am a certified pediatric nurse, I haven't done actual pediatrics for many, many years, and I've spent most of the last several years at the Poison Center looking at information about older adults. So.
Great, thank you both. So before I turn it back over to Katie and Marlo to dive into our topic today, I'm going to put up our agenda and then cover some housekeeping items for you all. So first, this session is being recorded. It is also being live streamed to Facebook. I will be sure to send the recording and a follow-up email after the session. You can also view it at any time after this on our Facebook page. In the follow-up email, I will also include a PDF of our slide deck, as well as all of the resources that we are going to cover here today. You can access many of these medication resources on our website as well, which is wapc.org. Again, that's wapc.org. All right, so on to our agenda for the day. We are going to start with just an overview of falls and then dive into our topic of medications and how they are linked to falls. We'll provide a little bit of prevention strategies for you and then cover how the Washington Poison Center can help you. If you have any questions at all today, please be sure to put them in the chat box or in the Q&A. We'll be monitoring both of those and we'll make sure that Marlo and Katie see them. Alrighty, I'm going to turn it over to Marlo now. And thanks again for joining us.
So just a little bit of background about the Poison Center and what we do. We are a free service. We are open every single day, 24 hours a day, every day of the year. We provide confidential services. So while we do ask you your things like your name, your age, we might ask you your medical history, your phone number. Those pieces of information go into a medical record. It's confidential, just like any other medical record, and it's not shared with anyone else. We do support over 200 different languages through interpreter services. So no matter what language you speak, you can call to the Poison Center and we can help. And our staff are specialists in poison information. We have nurses, pharmacists, and poison information providers available to take your call and assist you. And again, it's free, it's 24 hours. We help everyone in Washington state or outside of Washington if you happen to get routed to us. The poison helpline phone number, the 1-800-222-1222 is a national phone number. So wherever you're at across the country, you can call that phone number and reach a poison center for your area.
Okay, and I'm going to talk a little bit about falls among the older adults. So I'm sure everyone knows at least one person who's had a fall. And falls are so common that when they occur, we generally don't think about them and we're not really surprised when they happen. But falls are an exception to getting older. Falls are not something that we expect to happen when you get older. In Washington state, more than 1 out of 4 older adults will fall. Nationally, what that means is that there's one adult that falls every second. That's over 86,000 older adults that fall every day, and over 36 million that fall every year. So with that many falls, it's no wonder that it's the leading cause of injury and injury-related deaths in this particular age group. Next. So what happens when you fall? So sometimes you get back up and you keep on going, and sometimes you're not so lucky. For every 5 people who falls, one of those people will have an injury or a broken bone. And according to the CDC, last year there were over 32,000 deaths that resulted from falls. More than 95% of hip fractures are caused by falls, and women are more prone to this than men because women are more likely to have osteoporosis, which is a condition that makes your bones less strong. Up to 20% of people with a hip fracture will die within the first year of their injury. In addition to broken bones and other severe injuries, complications from falls, you can have financial difficulties because of the increased medical bills. And if you're still working when you fall, you've got lost wages while you're off work recovering. The average cost of a hospitalization for a fall in the United States is over $34,000. And annually in the US, we spend over $50 billion on medical costs that are related to falls. We don't have to fall, we're not expected to fall, and falls are preventable. So how do we prevent falls? Well, these are some suggestions, and it's not all inclusive. You need to stay physically active. Regular exercise improves muscle tone, reflexes, and it makes you stronger. So some medications can cause, or medical conditions can cause situations that will increase the likelihood to have a fall because it'll affect your balance, your reflexes, your blood pressure, or your nerves. You need to discuss your health with your doctor and know your limitations. Take precautions to keep yourself up on your feet. Have your eyes tested so you can avoid obstacles and see tripping hazards. If you have glasses, wear your glasses. Find out about the side effects of any of the medications that you take, and be aware of those that can cause sedation, confusion, or orthostatic hypotension, which is a condition where your blood pressure will drop when you get up from a seated position. There are other side effects of medications that can also have increased risks of falls. So talk to your physician or your pharmacist about those. And you want to get enough sleep. If you're alert and awake, you're less likely to have a fall. You want to limit the amount of alcohol you drink, since alcohol can affect your balance and your reflexes. And stand up slowly to allow your blood pressure to normalize. This is especially important if you're on any medications that can affect your blood pressure. And don't be shy. Use an assistive device. This is the time when you need to use your walker or your cane and make sure that they are sized appropriately for you, because those are not things that are one size fits all. You also want to be careful to wear proper footwear and avoid slippery surfaces. Some of this makes sense, and it's things that we've heard all our lives, but some of it's new to us as we get older and we start using and taking and needing more medication. So medications and falls. So the percent of older adult cases handled by the Washington Poison Center, as you can see from this graph, has gone up dramatically. In 1999, around 3.6% of our calls were from older adults. That's around 3,000 cases. In 2020, that had risen to 11%, more than 6,000 cases. Approximately every 10th case that we handle is an older adult. Last year, 71% of these cases were regarding a medication, and 43% of those medication cases were related to an accidental medication error. As we get older, we take more medicine, which increases the risk of making errors or exhibiting side effects. Calling the Poison Center can provide reassurance, and it gives you direction when you didn't know what to do, and it helps keep you safe. Last year, 43% of the time when we were contacted regarding an older adult, the reason was a medication error. But yet, older adults only represent 11% of our total cases, and they account for 30% of those errors. Next. As we age, the cells and organs in our body begin to lose function. And just like children are not little adults, the older adult is not a younger adult. We aren't like we were in the 30s. Some of the signs of aging are obvious. We have saggy skin, we get gray hair, we have a loss of strength and agility in our muscles. But other signs, like changes to our heart, our liver, our kidneys, our brain, those are less noticeable. And those less noticeable signs are going to increase our need for medications to control or support our blood pressure, our breathing, our urination, or other bodily functions. Aging increases our need for medication, and therefore we have an increased risk of medication error, and medication interactions are more likely. When those happen, our risk of falls will also increase. Marlo, do you have something to add?
Just to talk a little bit more about the medications involved. So over 80% of adults age 60 and over use at least one medication, prescription medication, and 45% in that age group use 5 or more medications. And the more medications you have, the more medications you use, it means you have a greater risk of drug interactions, of medication side effects, and the risk increases. Some medications do increase the risk of having a fall. And just to cover our bases here, this is not a comprehensive list. There are some that we just couldn't list every single one. There are many. These are some groups that might give you some idea of which medications can increase the risk of having a fall. And sometimes these effects only happen when you first start the medication. And as you continue taking it, the side effects improve, they get better, your body adjusts and gets used to the medication. And so that risk of having a fall will sort of decrease over time as the side effects improve. And we also want to make sure to always mention, do not change your medication or stop your medication without discussing it first with your provider. We're not telling anyone to stop your medications because there's a risk for falls, but it's more just so that you're fully informed what the risks may be. In many cases, the overall benefit of the medication is still more or higher than the potential risk from having a fall. So it's always good to discuss these concerns with your provider first, whoever prescribed it for you, and ask about the side effects, ask about what the risks might be, ask questions about your personal risk of having a fall, and talk about these things. Have a conversation with your provider so that you can be fully informed and also implement some strategies to help prevent a fall if you need to. One of the biggest reasons that medications can increase your risk of having a fall is poor adherence. And really what that means is not taking the medication as it was intended or as it was prescribed. So that could be maybe missing or skipping doses. That happens to everybody. You forget a dose, or you realize 5 hours later that you were supposed to take a medication and you haven't taken it yet, something like that. That happens frequently. It happens to everyone. Also starting and stopping medications. So maybe you are good about remembering for several weeks in a row, and then you go on vacation or you have another life change and you forget to take it for several days, or even weeks go by and you haven't taken it. So you start taking it again. That starting and stopping can increase your risk of fall because your body is adjusting to having the medication and not having the medication. It means you're more likely to experience side effects. Other reasons you might have poor adherence, maybe you didn't pick up the refill on time, or you forgot to pick it up. You're not sure if the medication is ready. Maybe there's issues with the pharmacy obtaining the medication, it's out of stock, something like that, and you don't get the refill on time, and so you run out. Another common one is people who set aside medication so that they can have them for use later on. They're stockpiling them. They're maybe worried about running out, or maybe they know their insurance is going to change, or they want to take the medication sparingly in order to save doses or save money. This is a really common one too. Maybe you have 10 days of medication left, but you can't pick up another refill for 20 days, or the refill won't be due for another 20 days. So you try and stretch out those 10 doses to last 20 days. And then you start taking the medication appropriately again when you get a new refill, and the side effects come back. So a lot of these changes to medication just mean that you are more likely to experience side effects, and that in turn may increase your risk of having a fall. So the bottom line here is consistency is key. You want to try and take the medication as it's prescribed every single day. And this is a good opportunity to contact the Poison Center if you have missed a dose, or if you've inadvertently doubled up on a dose. If you've accidentally made a change, maybe you took the wrong dose for several days and you didn't mean to, call the Poison Center. We can help, and we can give you instructions on what to do next, what the risks might be, and when it's time to go see your doctor. Couple of categories that are important that increase the risk of having a fall. Again, this is not a totally inclusive list, but just some to touch on. The big one is medications that can affect blood pressure. And the reason being that when they start working, they lower the blood pressure, and that can make you feel dizzy or lightheaded. You can feel faint. And that happens if your blood pressure is lower than what you're used to. So even though your blood pressure might be within a normal range, if it's lower than what you are used to, you might feel lightheaded. And the other time this happens is if your blood pressure is too low, you might suddenly experience a drop in blood pressure when you stand up. It's called postural hypotension. And that can happen if you're first starting a medication or if you're not used to it. It happens even sometimes if you are on multiple medications that affect your blood pressure. It's a pretty common one. So you stand up, get up out of bed, get up out of a seated position, and suddenly your blood pressure drops. You can see stars and get dizzy and have a fall. And some examples of medications that affect your blood pressure, obviously blood pressure medications, but also other medication groups, things that treat overactive bladder, medications that treat erectile dysfunction. They also have effect on the blood pressure and that they can lower it. So any medication that can potentially lower your blood pressure might make you dizzy and might increase your risk of having a fall. Another big group that could potentially increase your risk of having a fall are medications that lower your blood sugar. So these are usually used for folks with diabetes who are trying to prevent high blood sugar. But if your blood sugar drops down too low, that can cause dizziness. It can make you feel faint or lightheaded. You feel sort of like you're about to pass out. And examples of these medications would include any of the insulin medications, also the blood pressure or blood sugar lowering medications, glipizide, glyburide, glimepiride. Those are the sulfonylurea category of drugs, and they're really common in diabetes, or if you have diabetes, they're commonly prescribed to treat your blood sugar. Also, some newer ones on the market, they've been around a few years now, but are maybe less common. Prandin, Starlix are the brand names. Any of those kind of medications can lower your blood sugar to a point where you might feel dizzy or lightheaded. And that is an important thing to discuss with your doctor. If you're finding that your blood sugar is frequently too low, or if you're feeling really dizzy or lightheaded after you take your medication, that's something to discuss because you may need to adjust your dose. And sometimes it's a little bit of a, playing around with the dosage to get the exact right dose that's correct for you. that will keep your blood sugar in a normal range, but not drop it down too low. So if you're feeling side effects, it's important to discuss with your doctor so that you can get it straightened out, and potentially adjust your dose if you need to. And like I said, sometimes this is just sort of in the beginning phase of starting a new medication. You might find that after several days of having a lower blood sugar than what you're used to, you no longer feel dizzy or lightheaded with a blood sugar in that range. So it might just need a few more days or week or so to get used to it. But if it's continuing to happen, it's a good idea to talk it over with your doctor. And then medications that affect alertness and coordination. These are medications that in effect just make you feel drowsy or kind of groggy or woozy. These medications are really common, and there's a lot. There's a lot of examples. And again, this is not an all-inclusive list, but many of these medications that cause drowsiness are supposed to cause drowsiness. They are sleep aid medications, and they can be prescription or over-the-counter sleep aids. So things like Unisom or Ambien or Lunesta, those are the brand names, but they're also available as a generic. So if you're taking something that is meant to help you sleep, just be aware that after you take a dose, you might be groggy. And even if you're feeling awake and you're not asleep, it may have reduced your reaction time or made you a little bit less alert than you otherwise might be. And that means if you're, say, getting up from watching TV to go in and lay down and go to bed, that period of walking across the room, you might be drowsy or more prone to having a fall during that time. So it's just important to recognize that that effect may occur even if you feel awake. And if you stumble, you might have a reduced reaction time, so that you're not able to catch yourself before falling, or you're not able to stabilize yourself so that you don't fall. And that can happen also with other sedating medications too. Some common ones are the benzodiazepine drug class. They're sometimes used for sleep. They're also sometimes used to help improve things like anxiety or other medical conditions, but they do make you feel drowsy. And there are many benzodiazepines out there. Some of them are shorter acting, some of them are longer acting. And so it potentially could make you feel drowsy or less coordinated for even hours after you take it. And they're intended to. It's not necessarily a bad thing, but it is a potential risk for having a fall. Some other common ones are just your everyday diphenhydramine or Benadryl, and that's something that's over the counter. It's also used as a prescription to help with some medical conditions, but it's a really common medication. It does cause some drowsiness. Other medications would be maybe mood stabilizers or antipsychotics, things that are taken for mental health concerns. Some of those cause drowsiness. Anticonvulsants, those are medications that are used to treat seizures or epilepsy. Those ones also can cause drowsiness. And then some antidepressants. And if you're not sure if a medication that you're taking is an antidepressant or is a mood stabilizer, then ask your pharmacist, ask your doctor, and make sure you understand what the side effects are. Again, some of these things may improve as you continue to take it. So you might feel drowsy or kind of woozy, groggy the first few days. And as you continue to take your dose, that effect improves over time. So again, want to make sure that you understand it's not that you need to stop taking your medication or that a side effect means that you can't tolerate it. It might just mean you need a little bit more time for your body to get used to it. And then we can't really talk about sedating medications without talking about opioids. The opioid medications are those that are prescriptions used for treating pain. Things like oxycodone, hydrocodone, morphine, hydromorphone. There are many opioid medications, and virtually all of them can cause some amount of drowsiness or dizziness. You might also feel like you have less attention or have more difficulty concentrating. You might feel confused. In some cases, it can impair your vision and might make you a little bit more off balance or affect your gait or your walking. And again, this effect improves as you continue taking it and your body develops some tolerance to the drug. So these effects usually improve over time, but if you increase your dose or change your dose, or if you have any disruption because of adhering to your medications or not taking them properly, then you might feel extra drowsy. So opioids are a big one. In some cases, the drowsiness can actually be dangerous and affect your breathing. So it's an important one to note, but it certainly does increase your risk of having a fall. And cannabis. Cannabis is maybe not always thought of as a medication, but it can be used for medical conditions. A lot of folks are also taking it for recreational use. And cannabis can also impair your coordination and your motor function. It can decrease your ability to concentrate or have changes to your attention. It can slow your reaction time. And it also has some interactions with other drugs or other medications. So it can, if you're taking cannabis along with other medications, that means you're maybe more likely to have drowsiness, more likely to have blood pressure effect, more likely to have blood sugar effects than you would if you were just taking the medication by itself. So cannabis can also impact your risk for having a fall. And it's important that when you talk to your doctor about medications, you also include cannabis. Even if you're using it recreationally, it's important that your doctor know what you're using, how much, how often, so that they can then make healthcare decisions that are right for you and medication decisions that are right for you. And you can make those decisions together. And it's important that your doctor know all of the pieces of the puzzle, everything that you're taking, cannabis, medications, over-the-counter supplements, everything, so that they can be fully informed. Cannabis, over the past, say, 20, 30, 40 years or so, has really increased in potency. So the cannabis that we have on the market now is not the same cannabis, not the same marijuana that we had in the 1970s. The potency has increased, meaning the percentage of the active compound THC and CBD has varied so that it's a more potent cannabis product. It's a stronger product. So it might have different effects than maybe if you previously used 20 years ago. If you use a cannabis product today, it's probably going to affect you a little bit differently than it did in the past. So it's important to note that the products are stronger now, and you might want to start slow, start with a low dose until you see how it's going, to affect you, because it can be very potent. The other thing to consider is that products that are edibles, gummies or candies, brownies, things that you eat, they affect you a little differently than cannabis that is just a plant product that you might smoke or use in a different way. They affect you differently. And a lot of folks find that taking an edible product makes them feel a lot different than smoking it. It's a different sort of sensation. You might feel a lot more of that effect on your gait or your walking ability, or your movements might be a lot slower. And it's not necessarily dangerous, but it does potentially increase your risk for having a fall. So just be aware, edibles and other forms of cannabis products are not the same. They might affect you differently. And again, start slow, try a smaller dose first to see how it's going to affect you. There are also differences between different products. So maybe you try a new brand and it's the same dose, but that particular product, it might have more THC or more potent form of THC. It might have more active components than the product you're used to. So if you're trying a new product, start slow, start with a low dose, see how it's going to affect you first. And over time, that sensation, that feeling may improve and get better. The side effects will get better. So if you are using it for a medical condition, those effects may improve over time. Something else to note, we always recommend to make sure and not drive if you're using cannabis or other medications that really affect your alertness and your drowsiness level, opioids or other sedatives. Make sure that you don't drive. And that brings us to alcohol. So just like cannabis and other sedating medications, alcohol can also cause drowsiness and dizziness. And alcohol also interacts with many medications. So it means that you're at increased risk of having dizziness or drowsiness than you would be if you had the medication by itself. It can also cause impaired coordination. Everybody knows that, when you get intoxicated, you're stumbling, you're, maybe not able to react as quickly. And that's why it's recommended to not drive if you've been drinking. But, in some cases, it might not even be a good idea to, perform some daily activities that you're used to doing. You wouldn't want to climb up a ladder, for example, if you've been drinking alcohol or used a medication that is going to cause a lot of drowsiness, because of the risk. And that goes for falls as well. Just be aware that you're at an increased risk of being dizzy, lightheaded. That might make you more likely to have a fall than you otherwise would be. It also means that you are less likely to notice things that are maybe in your way, obstacles, or not even an obstacle, but maybe just a change of going from carpeting to wood floor and back again. That little change in height might be enough to cause a fall, or it might make you less able to use your mobility device, your cane or your walker, in an appropriate manner. So just be aware of the risks. Using alcohol increases the risk, and especially if you have other medications on board that can also cause drowsiness. Then just a note about the Beers criteria. You may have heard about the Beers criteria. You may be familiar with it, or maybe you don't know what it's all about, but it's basically a list of medications that are more risky for older adults. And it's not just because of falls, it's for all kinds of other reasons as well, other medical conditions that might make the medications more risky for you. But risk factors and other things that increase your risk for having a fall would be, like Katie mentioned, having osteoporosis, where your bones are weaker, more prone to breakage. That is a medical condition that if you add on a medication on top of it, that increases your risk for a fall. It means that the fall might be more dangerous for you, or that you're more likely to have a broken bone or an injury than you otherwise would be if you do have a fall. Another risk factor would be any medication or medical condition that causes dizziness or syncope. Sometimes inner ear medical conditions and things like that may create just a baseline level of dizziness that if you add a medication on top of that, that also causes dizziness, it just increases your overall risk. Delirium or confusion, any sort of dementia or cognitive impairment, such as Alzheimer's, those kind of things. If you're confused, you might be more at risk of having a fall, and especially if you add on a medication that also increases that risk. If you've had a prior fall, that in itself can increase your risk of having another fall. Prior fall, you might be still recovering from a fall. You might be weaker on one side, or have a broken bone that is causing you pain, or even bruising and less severe injury from a prior fall could make it so that you're more sensitive on that side. And so that changes your gait, that changes your walking, and that might then increase your risk of having another fall. And then Parkinson's. Parkinson's can decrease your strength, decrease your overall mobility, and that can again increase your risk of having a fall. So the Beers criteria is a very long list, multiple pages, and it's another thing that might be a good one to discuss with your doctor. There's a lot to it. It's pretty complicated, but these are just some kind of overall groups of things, groups of medical conditions that just increase your risk of having a fall.
Okay, other household substances. So it's not just medications that increase that risk. So anything that makes you lightheaded or dizzy can contribute to a fall. So you always want to use solvents and cleaners and chemicals in well-ventilated areas. And you always hear warnings not to mix chemicals and cleaners. Most of these are designed to work best if they're used alone. And when you mix them, you can decrease their effectiveness by diluting or neutralizing each other. But the other thing that can happen is that some common household cleaners can actually generate toxic fumes that pose a risk to your health and safety when they're mixed together. If you get lightheaded, move away from the area. You want to get toward adequate ventilation and sit down to decrease your risk of a fall. Okay. Medication errors. We talked a little bit about this earlier, but what is a medication error? A medication error occurs when you accidentally take a medication in a way that's different from how your doctor or pharmacist directed that it be taken. You can take the wrong dose, so 1 pill instead of half a pill. You can take the wrong medicine, meaning you grab the aspirin bottle instead of the ibuprofen bottle, or the wrong person can get the medicine. So you can take your spouse's medicine, or when you take your spouse their medicine, you actually give them your child's medicine. You can take medicine at the wrong time. So you either forgot a dose or you took doses that were too close together, and you can take it the wrong way. So maybe you took it with a meal or instead of on an empty stomach, or you have something like Spiriva that's supposed to be inhaled and you swallow it. So some medication errors are well tolerated, but some can be serious and can lead to symptoms that actually require monitoring. Next. So in 2020, we got more than 6 medication error calls a day regarding an adult that was 60 years or older. Most errors occur when the wrong dose is taken, and a double dose seems to be the most frequent reason we're called. But other examples include not reading the label thoroughly and taking the wrong number of tablets, or maybe measuring a liquid medication inaccurately. Grabbing the wrong bottle and taking the wrong medicine comes in as number 2. That one's pretty common. For example, you intended to take your antibiotic and you took your cough medicine by mistake. The last 3, wrong person, wrong time, and wrong way, are much less common. However, between the 3 of them, we get over 10 calls a week for someone who's 60 or over. Increasing the strength or concentration of a medicine by taking your doses too close together or taking a larger than prescribed dose can lead to an increase in side effects or any sort of a clinical effect or symptom that requires monitoring. And they may be lasting longer and more severe, and in some instances may require monitoring in a healthcare facility. Calling the Poison Center will allow us to take a thorough history and let you know what your risk is and let you know if you can stay home safely or if you do need to be seen in a healthcare facility. So the wrong medicine, wrong time, wrong medicine, wrong person, wrong way errors also present problems as they can cause interactions with your current medications or interfere with a current existing medical condition, especially if you're taking the wrong medicine. It's someone else's medicine and it's new to you. The side effects may be very unexpected for you. And again, this increases the risk of falls. Calling the Poison Center will help you know if this is something that you're going to be safe at home and how long to expect these symptoms to be lasting. So these suggestions help apply to more than just medication errors, but they also apply to exposures to household products and chemicals. Anytime you've got lightheadedness, dizziness, anything that might increase that risk of a fall, don't drive. Get up slowly. Use a handrail. Watch for tripping hazards and use some sort of support to walk if you're unsteady on your feet. Use your cane or your walker. And if you fall, call your physician. If you're on a blood thinner, any sort of a fall requires that you contact your physician or go into an emergency room, since there's always a risk of internal bleeding with a blood thinner. Okay.
So now we're going to talk about some strategies for prevention. So what to do to help prevent all of these things from happening in the first place. And the biggest tip is to ask for a medication review. And we want to do that at least on an annual basis. But if you're finding that you've had a lot of medication changes recently, or a lot of changes since your last medication review, you might want to do it more often than once a year. And like I mentioned earlier, it needs to be comprehensive. So not just your prescription medications, but also over-the-counter medications, vitamins, supplements, herbal products, also any other substances you might be using, such as alcohol or cannabis or other drugs. And you want to also consider medications individually and how they're going to work or how they're going to affect you when they're all combined together. And this sort of medication review can be done with your pharmacist or your primary care doctor, or it could be done with both. There might be things that the pharmacist notices that the doctor didn't, and there might be things that the doctor notices that the pharmacist didn't. So it's a good idea for everybody in your healthcare team to understand everything that you're currently taking, again, including over-the-counter things, vitamins, supplements, and other drugs. Because if they're not aware of what you're taking, they can't make the best recommendations for you. So it's important that your pharmacist, your provider, they all know everything that you're on. And another tip, I think, for this is to utilize a single pharmacy if you can, because that way that pharmacy will have all of the records of all of the medications that you're on. Whereas if you're picking up one medication at one pharmacy and you pick up other medications at a different pharmacy, they might not realize that you're on those other medications if you're picking them up somewhere else. If you purchase them and get them from a different pharmacy, those records aren't going to be shared between those unless they're part of the same system. So, one Bartels may be able to pull up what other meds you filled at other Bartels, but they wouldn't necessarily have information from other pharmacy chains or other places if you've picked up, and they wouldn't know your over-the-counter medication. So if possible, stick to a single pharmacy and make sure that they are aware of everything that you're taking. Once you have the medication review, your provider may decide to stop some of your medications. They might decide to switch to something safer, a different alternative, and they might decide to reduce your medication dosage to make it less likely to cause side effects, or make it the most effective dose at the lowest strength possible. That's a really common one too. And again, make sure never stop or change your dose without discussing it with your provider first. You want to make sure that your provider is telling you when it's okay to stop taking your blood pressure medication or change to a different one. It's also a good idea to discuss during the medication review and ask questions. Do I really need 3 different blood pressure medications, or can I just take 2? Are there different ones that I could take that would maybe enable me to just take 1 medication? So these are the kind of questions that are important to discuss with your provider, because there may be ways to simplify your medications and then make it less likely that you're at risk for a fall. And of course, it's not just the pharmacist and the doctor is their responsibility, it's also your responsibility. So you want to take the next step once you have the medications and you're taking them appropriately to implement some medication management strategies to help you take them safely. You want to understand your medications as much as you can. You want to know the name, the dosage that you're on. You want to know when you started taking it, how long you've been taking it, how many times per day. You want to know all the details of your medications and what the side effects might be. So at the Washington Poison Center, we have this handy sheet, 10 medication questions to ask your provider or pharmacist. And these are questions about side effects and what to expect when starting a new medication or having dosage changes. These are good questions to take to your provider during that medication review. And you can always ask questions at any point. It doesn't have to be during a medication review, but if you're stopping by the pharmacy to pick up a medication, you could certainly ask your pharmacist a question at that time. You want to make sure and never take medications more than what you're supposed to. Just take it as prescribed, as it's written on the label, and let your doctor know if there are any concerns. If you are feeling a lot of side effects, or if you, for some reason, maybe you find you can't take it at dinner time every day, it's not, maybe your medications aren't with you at dinner time, and so you're having trouble taking it when you're supposed to, talk to your doctor, talk to your pharmacist about it, so that you can work together to create a medication plan that's good for you. Use a medication list. So this is a good thing to have at home and even to keep on your person, so that you know at any point all of the medications you're on, and again, the name, the dosage, how many times a day you take it, at what time, what it's used for, and any special instructions. So take this one with food, or take this one on an empty stomach, or take this one 30 minutes before a meal. Those kind of instructions are important. And it's good for you to understand all of these pieces of the medication list, but also so that others can help to understand it too. Maybe your caregiver, your family members, your spouse. If there is an emergency and you say need to go to the hospital, then the providers you see there will understand what medications you're on. So having a medication list available to you is a really solid resource to have for safety. And it also just helps you to keep track of your medications. This is a good thing to have handy if you call to the Poison Center, because it's very likely we're going to start asking you some of these questions. What's the strength? What's the milligram amount of this drug? What's the name of it? What time were you supposed to take it? All of these questions help us to analyze the situation and determine the risk for you and make proper recommendations. So our assessment is based on all of these pieces that you can tell us over the phone. And same goes for your usual pharmacist or doctor if you have questions for them.
Okay, so physical tracking systems. So in simple terms, this is a way to know if you've taken your medication or not. And the first step in knowing is what you need to take and when, is having that medication list that Marlo just talked about, all of those details that she mentioned. And then you need to keep track of, have you taken the medicine? There are many ways that you can do that. Some people use a medication checklist where they literally check off when they've taken something. You can write it on a calendar if you don't have too many medicines, but the more medicines you take, the harder it is to keep track of it. There are cell phone apps available. There are pill keepers or pill boxes that are available. And some pharmacies have an option where you can request your medication all bundled together in a daily blister pack. Some pill keepers are fancy. They can be locked and programmed so that they only open when it's time for the medicine. That's not the case for most of them. Most of them just flip open and you have access to your pills. Pill keepers keep the medicines organized to make them easy to take. And unless they lock, they don't secure the medication. If they make it easy for you to access to take your medication, then they also make it easy for a child to access and get into that medication as well. So pill organizers are not child resistant. You need to keep them up and out of reach if you're going to use them. And what do you do when you don't need your medicine anymore? Maybe it's a prescription that you finished, or the doctor has chosen to change a dose of something and you've got an old strength. Well, The way to safely get rid of your medications is to use a medication return system. So takebackyourmeds.org is a website that's managed by the Washington Poison Center, and it will provide disposal locations in Washington and surrounding states. It's completely free. You log on to the website and you search for a location to return your medication. There are over 500 locations listed. The other thing that's listed on the website is where you can pick up a mailer so that you can put your medicines in an envelope and mail it in to a secure medication facility. So if you're not close to a drop box, you might be able to be close to a mailer. You want to store your medications for family members away from medications for pets. One of the calls that we get at the Poison Center is frequently someone who has taken their pet's medication. But you also don't want to mix up family members' medications. So we recommend using a visual reminder to help you remember to double check that medication label to help prevent a medication error. You can put a rubber band around the pill bottle. You can use a Sharpie to color the top of the lid. You can write someone's name on the top of the lid. You can use colored Velcro strips. Those are just a few ideas. Some pharmacies actually offer colored rings that could go around the lid so everybody in the family has their own color. You can also request different color pill bottles to distinguish pet medications from people medications. No matter how you choose to identify or keep those medicines separate, it's important that you always keep the medications stored securely, up and out of reach of children. So high-risk medications, things that can be very serious if a single tablet is ingested, or things that have very severe side effects, should be stored in a lockbox that uses a combination or a key, or in a locking cupboard or cabinet. Marlo mentioned earlier letting your provider know any substance that you use other than medications. It's very important that you share this information. Your safety requires an honest and open discussion with your healthcare provider. Their knowledge of your substance use, either medicinally or recreationally, is confidential. And it's necessary to ensure that the treatment that's recommended by them is not going to cause you harm. It needs to help you. We talked about those medication interactions earlier and the side effects. Well, this is why your provider wants to know. They want to prevent that when they're asking about your substance use.
So how can the Poison Center help you? Well, like we've mentioned, we are available 24 hours every single day. Our phone number again, 1-800-222-1222. Our calls are answered by nurses and pharmacists and poison information providers. We are available to answer questions about medications and side effects. We can answer questions about drug interactions. We can also answer questions if the medication error has already happened. You took an extra dose, and like Katie mentioned, we get those sorts of calls all the time. Or you took the wrong dose or someone else's medication. What we do is we assess the situation to determine if it's dangerous for you. We can give you instructions of how to safely deal with the situation at home, or we can help you determine if you need to get medical attention. Is it time to call your doctor, or is it time to call 911? Is it time to go into the emergency department because the situation is unsafe? We can help you make that determination. That's what we do. So call the Poison Center again, 1-800-222-1222. We're here to help, and you can call us anytime. Again, our calls are all confidential. We're not going to share your information with anyone else. We are here to help. And then finally, another way that you can help determine if you're at risk is by taking our self-assessment. And this is available on our website. It'll also be available with information for this presentation after our presentation is over. The self-assessment has 3 categories, and it focuses on safe medication storage, medication knowledge, and medication management strategies. And the guide is indicated to prompt you to consider your own practice and how you're taking medications, the environmental things around you, the things in your home or your workplace or wherever you're at that might impact your medication and your ability to take them safely. And for example, how you're storing your medication, how well you're adhering to your medication. All of these questions are prompted by our self-assessment. So this is a good tool to use to determine if you're overall taking your medication safely and what you could do better. And that again is available on our website. You can always call to the Poison Center if you have questions. Again, 1-800-222-1222. You can call us anytime. And thanks for your time today. We've enjoyed presenting for you. If you have any questions, we have a few minutes that we could answer some questions in the chat.